Washington Journal continues.
More on healthcare with Representative Xavier Becerra, Democrat from California, and the House Democratic Caucus Vice Chair. Thanks very much for being with us.
Always good to be with you, Steve.
What's the final vote count today?
We win. What the final vote count will be, I can't tell you. Some of these decisions are made by members at the last moment, but we get the votes.
Who are the key votes that you're keeping an eye on right now?
There are members who are doing a lot of soul searching on the issue of abortion, trying to make sure that they believe that we are going to leave the system in place where there are no federal funds used for abortion. There are some people who are trying to make sure that this is a system that will not unduly change the system in ways that might hurt their district. And once they have that sense of comfort, we'll see.
Catholic bishops sending a letter saying don't pass the bill. Some maneuvers yesterday, including an agreement by the president to sign an executive order that would restrict any of these funds to be used for abortion. How does that play out?
I learned a lot from nuns when I was growing up, and the nuns are for this bill. We have the Catholic hospital system that's for this. And so what we're going to find is that people have to do their soul searching, and at the end of the day, we believe we're going to have the votes we need to pass this bill because, one, it does not provide any funds, federal funds for abortion, and what it does is it helps us provide more quality, affordable health care to the 180 some odd million Americans who currently have health care through their employer. We add another 32 million people to the rolls who don't have insurance. So at the end of the day, I think people will weigh this and say, history commands that we move forward, make progress. I think we'll pass it.
You still have more than 30 Democrats who are saying no to this bill. Why?
Any number of reasons. The same reasons you might have some Americans who say no. Some believe that the current system works better for them and their district. Some members are very concerned about issues like abortion. Some members just can't quite get there for whatever reason, and we respect that. This country runs on a majority, and we intend to seek out and secure a majority to pass this legislation.
Doug Holtz-Eakin, former Congressional Budget Office Director, has penned a very detailed editorial this morning in the New York Times. The essence of it is this. The bottom line is that Congress would spend a lot more on health care, steal funds from education, Social Security, and long-term care to cover the gap, and promise that future Congresses will make it up by taxing more and spending less. One of the examples that he puts on the table is gimmick number one, the way the bill front loads the revenues and back loads the spending. That is, the taxes and fees it calls for are set to begin immediately, but its new subsidies would be deferred so that the first 10 years of revenue would be used to pay for only 6 years of spending.
Steve, I'm surprised that Mr. Holtz-Eakin would say that because as the former Congressional Budget Office Director, he understands how people attack the CBO all the time. But it's the only referee that either Republicans or Democrats can turn to because they are independent, they're impartial, they are nonpartisan, and if we can't trust the CBO's numbers, then we're lost. It's a food fight. And so I think what Doug knows is that these are all projections based on a lot of deep analysis, as Doug used to do when he was CBO director. And what the CBO has told us, not Republicans, not Democrats, is that this legislation will save us, will reduce the deficit in the federal government by 100, and actually there's a new figure that the CBO just came out with. It used to be 130 billion. We were just told it's over 140 billion now that they tweaked the numbers a bit more. Over the second 10 years of this bill's existence, we will save over $1 trillion. 1.2 trillion. We can argue about the details, but the fact remains the Congressional Budget Office, which Doug used to direct, has said we're going to save money. Why? Because we do a number of things. Some are more painful, but we do things to move the country forward, because as we speak, a child is being born in this country who will have a bill of over $8,000 to help pay for today's health care costs. Now, if that child is born healthy, obviously a lot less. A little sicker, a lot more. But one way or the other, we are paying for each and every person in this country, including the child born right now, over $8,000 per person, the most expensive health care in the world. That will break us, whether it's private insurance or whether it's Medicare or Medicaid or veterans health care. You can't continue. Status quo, some people will cling to it. We're ready to move forward.
We'll get your phone calls in just a moment. You can also send us an email comment at journal@cspan.org. Thousands and thousands of Tea Party activists on Capitol Hill yesterday. This seems to be the genesis of a new political movement. Will it impact you and the Democrats in the midterm elections?
I hope we continue to see Americans come out and express themselves. I remember when I was growing up, there was a time when the apathy among Americans was growing and growing, and people were concerned that Americans wouldn't even vote anymore. And so I think it's great to see people out there. Regardless of their political affiliation or their opinion, the more they get out there and express themselves, the better. Today we're going to see tens of thousands, if not more than 100,000 people in the mall expressing themselves on a number of issues, including immigration reform. And so I think it's great. I have nothing but great respect for people who take the time to come to Washington, D.C. and make their voices heard. Better that than having a lot of very influential lobbyists shilling for a lot of very wealthy companies and individuals making policy for this country.
Jason, though, has this point that we've seen Idaho being the first state and the first governor to sign a bill into law that would not allow federal mandates to move into his state of Idaho. 37 states are moving to nullify the federal mandates on individuals to buy health insurance.
Medicare, we were told all the horror stories about Medicare in 1965. We were told all the horror stories about Social Security back in the 1930s. You can't do this. Same type of movement, same type of accusations of socialism. We now have two of the most important programs that help seniors stay out of poverty, Medicare and Social Security, in place. Seatbelts, there were people who said the same thing about seatbelts. Can't have them, should mandate them. Today we buckle up without any thought. We'll move forward.
Carl joining us from Los Angeles, Democrats Line. Good morning.
Yes, I'm just calling to ask to see if the Republicans and the Democrats are agreeing on 70% of the bill. Why would they have to start over?
Carl, that's why we're going to have a vote today. No one believes that the current system that costs so much money is where we should end up. And we have had over a year's worth of conversation, discussion, debate, amendments. We've had close to 100 years of discussing this issue, and we're ready. As the President said, it's time for an up or down vote. We will get there. The bill isn't that dissimilar to what Republicans in many respects have proposed. It differs in some respects, and for that reason we have some people who are opposed. We respect that. We need to find a majority. We intend to find and secure a majority, and we'll move forward.
Kathy has this comment via Twitter. She says, I think it's great to see people out there referring to your comment just a moment ago. However, because we know better than them, we will simply ignore their wishes.
No one's ignoring anyone's wishes. I know as I go back home, the people in my district want this. They're desperate for this. I get letters all the time from people who need this. I hear from people throughout the country. I won't get reelected if I've ignored the people. I don't believe I've ignored anyone.
Your colleague, Representative Nunes, says that your state of California will be, in his words, crushed by these federal mandates.
My in-laws live in Representative Nunes' district. They are desperate for this. And so they're not my constituents, they're their constituents. I know what they're thinking because they're my in-laws. They won't get crushed. We'll get crushed if we do nothing, because the system is already weighing us down far too much. Talk to the people who can't get insurance because of a pre-existing condition. Talk to the people who thought they had insurance but went in to use it and were told by the insurance company, guess what? That's not insurable. Or talk to the folks who haven't had a chance to get insured because they can't afford to pay $7,000 or $8,000 for an individual policy that still has very high deductibles, high premiums. We'll get crushed if we don't do something. Everyone agrees with that. We cannot continue to spend 17% of our economic capacity, our GDP, on only health care. As GM has said, they put more money into health care than they do to buy the steel for the cars that they manufacture. You can't do that.
Another call from California. William on the Republican line. Good morning.
Good morning. Just like to say that all these, I'm a Republican, but I am hoping for this bill to go through. Self-employed. I do have my daughter that has a pre-existing condition, and I cannot afford to pay anything, or I can afford some, but not the charges that they are asking, or that they ask for me to pay. In all these fights that is happening, just because of the Republicans and Democrats, and all the fear that the Republicans tend to put on people is horrible.
William, I think a lot of us agree